Following the recording of our previous coffee conversations, changes have been made in reference to health assessments and immunization requirements, providing flexibility in certain health assessments and immunization requirements due to the impacts of the pandemic. All students who were dismissed because of failure to submit the required health assessment and immunization record may return to campus on Tuesday, September 28, 2021. Parents have until October the 8th, 2021 to prove an appointment, which can be a note from a parent. Beginning November 1st, 2021, families will have 30 days to present the required health assessment and immunization record. On December 1st, students who have not met this requirement will be dismissed from school. Hello, and thank you for joining us for Coffee Conversations. Today, our special guest to address COVID-19 updates, immunizations, testing for students. We have with us Shirley Bolden, who is our Director of Health Services, and Dr. Jennifer Green from our Director of our Cumberland County Health Department. Thank you both for joining us again and having this conversation with us.
Thank you for having me.
Thank you for having us again.
Let's go ahead and get started. So, what are the COVID-19 protocols that Cumberland County Schools has in place to protect students and staff? I know we've addressed this before, but if you want to do a brief overview of some of those protocols that we have.
Okay, well, we are doing universal masking, where all folk are wearing masks at all times unless they're eating lunch. We are also physical distancing to the greatest extent possible. That can be a little difficult when we have all of our people back in school. And we are getting ready to launch screening testing. And so that will help us identify kids who are positive and also staff who are positive very quickly, and to be able to limit the number of people who are exposed to a COVID-19 positive person.
Excellent. So we hear about the rise in COVID-19 cases, particularly related to the highly contagious Delta variant. What are the mitigation strategies that are used to protect our students and staff? And I think Ms. Bolden, you addressed those strategies in our first question. So anything else you'd like to add to that?
Yes, so what we do is we follow North Carolina Strong Schools and Department of Health and Human Services and CDC for quarantine guidelines. So one way that we keep our schools and staff safe is that if a person has been exposed to a COVID-19 positive person, they're placed into quarantine. And then, of course, if they test positive, they're placed under isolation for the specified days. And during that time, while they're away from school, we're making sure that they are provided all of their academic work, and so that kids don't feel like they're totally getting left behind. So although they're learning at home and logging into their campus course, that they still have that connection to the classroom teacher.
And can I add one more thing to that? Is because the Delta variant is so contagious, it's really critical that we layer levels of protection. So that means, as Ms. Bolden said, wearing your mask and getting vaccinated. So even if our students and teachers are vaccinated, we still need to wear a mask because the Delta variant is so contagious. So we're going to put both of them in place, and then also making sure that our students that are eligible, that are over 12 and older, and all of our teachers and our faculty and staff that are eligible to get vaccinated have the opportunity to do that. And putting all of those levels of protection in place really gives you a good barrier against the Delta variant.
Thank you, Dr. Green. So, Ms. Golden, you mentioned a strategy that is newly implemented, which is the opportunity for students and staff to test. Can you talk a little bit about what that process will look like in our schools?
Yes, beginning next week, we will be partnering with MACO, and we're going to offer testing throughout the day. So if we're at a school, we'll be at that school one day a week. So if I'm at your child's school on Monday, we will be screening testing every Monday. So what does that mean? That means your child does not have to have a symptom to be tested, okay? So on Mondays, if we're over at WH Owen, we're going to be there every Monday. So we will test a group of kids before school. There'll be another group of kids who are tested at lunch, and then we'll reserve after school for athletics and staff. We will continue this process throughout the whole school year, and in efforts to ensure that we're quickly identifying students and staff who've been exposed to COVID-19 and are now positive.
So that's a new strategy, and definitely one that will be helpful to our students and our staff. We talked in one of our previous recordings about COVID vaccination shots for students. Will Cumberland County Schools provide COVID vaccination shots for students moving forward? And if not, where are students or families able to go and get these vaccinations?
So I can start with where we're vaccinating at the health department. And we're so appreciative for Ms. Bolden and her team. We're continuing to think and strategize about how we can get students access to vaccinations. So a couple of initiatives every day at the health department, Monday through Friday, 9 a.m. to 4 p.m. You can get a COVID vaccine. You do not need an appointment. You can just walk right in. We also have a number of COVID vaccine outreach clinics, including at our library. So every Saturday in October in our library system, you can go to one of our libraries and get a free COVID vaccine. So if Saturday is the day that you need to do that, you can take that opportunity. We'll also have a number of outreach clinics that are available throughout the community. And you can go on our website, cumberlandcountync.gov, and you can check out our outreach calendar for our vaccines for both our parents and our teachers, as well as our students that are ages 12 and up.
And in the past, you're correct, we have offered some vaccination clinics on our campuses, and that may happen again in the future. We do not have any details for clinics finalized at this time, but that may be something that we offer again.
So speaking of our vaccines and the opportunity for students to be vaccinated, what is the benefit of having the COVID-19 vaccine if students and or adults are still able to contract COVID-19?
So the big thing is our vaccines reduce the risk of severe illness, hospitalization, and death. So statewide, if we look at our numbers here in North Carolina, if you are vaccinated, you are 4 times less likely to get COVID, and you are 13 times, almost 14 times less likely to die from COVID, even if you're infected. So those two numbers for me really stand out about we really reduce our risk of severe illness and dying from COVID if you're fully vaccinated. And if we think about not just infection in our classrooms and our school systems, all of our students go home to parents, maybe to grandparents that are immune compromised or siblings that are too young to get vaccinated. So this really reduces the risk, not just within our school boundaries, but within our community and within our own households. And if you do get COVID after you've been fully vaccinated, the data and the research is really strong that you're most likely to have a mild case and not have to end up on a ventilator. And we want to make sure that we're protecting, doing everything that we can to protect our families.
And another benefit to that is if your child is fully vaccinated, or if you're employed and you're fully vaccinated, you will not have to quarantine if exposed to COVID-19. We do recommend that you test 3 to 5 days after exposure if you're fully vaccinated, but you will not have to miss valuable in-person instruction or time at work.
So one of the big questions that families may be asking, and I know Ms. Bolden, you and your team are constantly in contact with families. If students come in contact with someone that is COVID-19 positive, what steps should they take?
So the very first thing we want them to do is notify their building administrator. We want them to automatically stay home, quarantine. The building administrator will notify the Office of Health Services. One of our contact tracers will be in touch with the family. We will establish the quarantine guidelines at that time and a return date.
And the other piece that I think is really important is we're so grateful for our school team for helping us with contact tracing. And those guidelines should be followed outside of the classroom and school setting too. So if you're put on quarantine by the school district, they've done that in collaboration with the health department. So that means that you are also quarantined outside of school too. So going to the grocery store, or going to school, or going to visit friends and families, it's important to follow those for school settings and outside of school settings as well.
I'm going to go back a little bit to address one of the mitigation strategies, which is the COVID testing that's now available for students and staff. Ms. Bolden, is there a deadline for families to opt into that COVID testing if they would like to participate or have their child participate?
We're going to leave the testing window open, but we are encouraging families to register as soon as possible, just so that we know how many staff we need to provide the services to our schools, because we want to be efficient and want to make sure that we can get kids back to class quickly. We anticipate that time away from class would be no more than 5 to 10 minutes. So that's why we're trying to do it before school, during the lunchtime, and then after school, because number one, we focus on academics, but we also know that health is a high priority for the district as well.
Dr. Green, a question for you regarding us being back in school starting in August. Has there been an increase in vaccinations in the community since school has started?
We have, and so I'll take the opportunity to say thank you, parents, for doing that. As we led up into the school year, and as we are seeing more vaccination efforts, we have seen an increase in the numbers of our community members, including our students, that are getting vaccinated. So many of you took advantage and did that before the first day of school. But I'll tell you, we need more people to be vaccinated. We have about 50% of our total population, 52% of our total population fully vaccinated. If you just look at our 12 and older population, we're somewhere in the 60s percentage-wise. We need those numbers to be in the 80s and 90s. So we need your help, parents, in getting your students that are 12 and older vaccinated, and yourself vaccinated if you haven't taken the opportunity yet to reach higher levels of immunity. We need more people vaccinated. So thank you, but we have more work to do as well.
And Ms. Bolden, school immunizations is not anything new. We've had school immunizations in place pre-COVID-19, but what is the deadline for school immunizations? I think the deadline has passed for students that started with us at the beginning of the school year, but what is the priority for our immunizations for students for in-person learning?
It's easy to get back in school. You just have to present that information. If you're having trouble scheduling an appointment, the health department is offering immunizations, and Dr. Green will talk a little more about what their hours are, but we definitely want to help you remove barriers. So if you're having trouble finding a location, again, the health department is going to be sharing things, but you can always give us a call and we'll help you work through that.
So we have a couple opportunities this week. We've been encouraging folks for the last couple of months to get their immunizations early. If you still need some immunizations, we are hosting a Vax Yourself and Vax Your Pet clinic on Saturday, October the 9th. Here at the health department, you can come get your back to school immunizations. You can call the health department 910-483-3600, 910-483-3600 to get your appointment for your back to school immunizations. We also have some walk-ins on a limited basis, but we'd really strongly encourage you to call us and make an appointment for that so that we can you can limit your wait time here. You can also go to your primary healthcare provider if that's an option for you.
So we have covered a lot today between COVID-19 updates and immunizations and next steps for getting all things taken care of so that we will be safe in school. Is there any additional information that either of you would like to leave with families?
I have a couple of things. I want to go back to immunizations a second. With immunizations, I want families to understand when you move in to North Carolina and your child has never attended a public school, your child will be required to have the North Carolina Health Assessment revised 2016. Make sure your health assessment form says revised 2016. So it doesn't matter if you come to us in April, you will have 30 days from the first day of that your child attends school to present that required information. That is a process that we go through all year because that's another way that we keep families safe and keep students safe, because making sure that everyone has the required vaccinations. Then I'd like to talk a little bit about the COVID testing. Walgreens, a lot of our local pharmacies have these home tests, and the home tests are really great for letting you know that your child potentially has tested positive, but for school purposes, we require a lab-generated test. And the benefit of getting the lab-generated test is that if your child is exposed to COVID within 90 days, your child will not be required to quarantine. So for 90 days, once your child tests positive, they will not be required to quarantine once they have a lab-generated test that shows that they have a true positive.
And if your student is symptomatic or your child is symptomatic on a day that, and it happens to be on a day that they don't have, it's not their weekly testing day at their school, you can go get tested at the health department. We're here Monday, Wednesday, and Fridays from 9 a.m. to 4 p.m. Of course, your school is the best place where you can get that weekly testing. If it's an off day, don't hesitate to come see us. We'll be here. You do not need an appointment to do that. And then again, you can go to our county website for another additional. But we'd encourage you to take advantage of what's available at the school because that's free to you and in a convenient location for your student.
So thank you again. Thank you both for sharing that. Always bringing us the information that we need to make sure that our students and families are safe. So thank you for joining us. Thank you, families, for joining us for another episode of Coffee Conversations. Please join us next time. Ms. Bolden, thank you and your team for your work. And Dr. Green, thank you so much for joining us again. Have a wonderful day.
Thank you.